Let everyone know I did go ahead and start the recording now. So.
Chris, can you hear me?
Yes, sir.
Can you see me?
No, ma'am. I'm getting a low bandwidth. There you are. Yeah, that's mine. Oh, I'll reprint it. Thank you.
See you later. See you soon. So I can see and hear and see everyone. Can you all hear me?
Yes, ma'am.
Yes. Hi, Miss Diane. Can you hear me? It's Shalonda. Okay.
Yes,
Are we
ma'am.
ready to begin, everyone?
Yes, ma'am.
Okay. It is now 4:31. We will call this meeting of Justice, Health, and Welfare Committee to order. The purpose of this meeting is to get an update on the COVID-19 vaccination program and the outreach activities. Madam Clerk, would you please call the roll?
Councilmember Webb, Councilmember Webb,
Present.
thank you. Councilmember Days.
Here.
Councilmember Fitch.
Here.
Councilmember Clancy.
Here.
Madam Chair, you have a quorum.
Thank you, Madam Clerk. The committee takes official notice of and admits into evidence all St. Louis County ordinance and resolutions. At this time, I would like to introduce our panelists. Today we have with us Dr. Khan, the St. Louis County Director of Public Health, and Mrs. Spring Smith, Deputy Director of St. Louis County Public Health. At this time, would either of you like to make an open statement or greeting?
Thank you, Madam Chair. Thank you, everyone. Thank you for the opportunity to provide an update to the Council Committee on Health and Justice about ongoing DPH efforts to reach out to our community across the St. Louis County area to educate people about COVID vaccination. And while this is an ongoing effort, I think an update is timely.
Ma'am, you're muted.
Thank you, Dr. Khan. And thank you for joining us today. Mrs. Spring Smith, would you like to acknowledge our audience today?
No, ma'am, just thank you. It's good to give an update.
Are you referring to me, Miss Diane, or Spring?
No, ma'am, I didn't say anything. I think Ms. Schmidt responded to you, and I think you are ready for item number 3 on the agenda. Can you hear me okay?
Miss Diane, can you hear my voice?
I can now, yes.
Yeah.
I'm getting a low bandwidth signal. Oh, there she is.
Yeah, the video feed seems to be working. I think the audio is fading in and out.
Thank you, Miss Spring.
You're on now, Madam Chair.
Awesome. Here I am. I apologize for the technical difficulties. I prepped today to ensure. That will be for me, Dr. Khan.
Would you like me to go ahead now?
Thank you, Madam Clerk. Yes, sir.
Thank you. Chris, are you able to run the slide deck, or would you like me to do that?
Sir, that is your choice. If you want to do it, I can give you presenter privileges. If not, I can do it.
You can go ahead and give me your presenter privileges, and I'll just open it up.
Give me just 1 second. You are now the presenter, sir.
Thank you. Just bear with me for 1 second. Okay. Can everybody see the title slide? Thank you. Okay. Thank you, everyone, for your attention today. We really appreciate it. Obviously, there is an intense amount of work going on in terms of community outreach and update, which is necessary. Everything that we are doing requires a lot of effort and dialogue, as you'll see listed in the slide deck, and I'll walk you through that. It is still not enough, and we still are finding more and more ways of being innovative in trying to reach out to people, engage them where they are, and hopefully to follow through and provide them vaccine where they can get it in the most convenient and comfortable manner possible, overcoming barriers of access to care, transportation, etc., and immobility wherever. To date, in terms of the equity component, that is a central principle of everything that we think about and everything we try to do. I want to highlight the fact that we've provided upwards of 60,000 first dose appointments. And so that is data from a couple of days ago that has increased. Just to give you some idea, we're probably giving out 15,000 doses a week combined at our health centers, plus the different fire departments, as well as EMS partners and other mass vaccination sites and smaller sites we're running. In terms of Missouri's overall vaccination picture, I'm sure you've seen this data as well. The share of the population that has initiated vaccination seems to hover around the 28% mark. That is still relatively short of where we want to be, and off that, only 17.2% have completed vaccination. So there's a variety of reasons for that, which our state colleagues have highlighted as well. Supply is a major issue. Vaccine hesitancy remains a barrier. And three, people do encounter misinformation online and are reluctant to make the jump from gathering facts to getting an appointment for a shot. So it is a bit of an uphill battle, but we are making slow, steady progress. We want to be way ahead of where we are today, but it is heading in the right direction. Incidentally, the national data as of today reveals that about 1 in 4 US adults has now received a dose of the COVID vaccine, whichever one was available. In terms of vaccine doses administered per day, there's been a steady increase. There have been hiccups along the way, which have been the result of supply-related issues as well as logistical issues. The supply side of things is something that we have worked very closely on with our state partners, the DHSS. Obviously, they are dependent in turn on federal partners for shipment of vaccine. Just to give you an example, this very week, our regular supply was supposed to be around 8 trays of the Pfizer vaccine. As a result of some federal delays, the federal tranche of vaccine being shipped to Missouri was reduced. And so as a result of the direct result of that, Missouri's share coming to St. Louis County was reduced. So it went from 8 trays to 5 trays. That impacts our ability to schedule events, obviously, as you can imagine, because we can't really have vaccine sitting around. We want to get it in as many arms as possible, as quickly as possible. But sometimes these supply side events do create problems. That dip that you see towards the end over there is the result of supply issues as well as logistical issues. Also, the fact that there were events that didn't quite pan out the way we wanted them to. We probably didn't have as many doses given out as we would have liked. So I wouldn't pay too much attention to that dip. It is likely to even out and begin increasing as you will see the supply side ease off over the next 2 to 3 weeks. You will have seen coverage in terms of specific vaccines. The president has put out different statements about, ordering 100 million doses of the Johnson & Johnson vaccine and then doubling it shortly afterwards to 200 million doses that would be distributed. To date, that supply has not come through. So across the St. Louis area, there is a shortage of the Johnson & Johnson vaccine. Area pharmacies, which receive their shipments directly from the federal government, have also experienced a shortfall, and as a result, they've had to turn away some irate customers. We've heard from the public about those very issues, but we obviously have no direct control over it because pharmacy chains get their supply directly from the federal government. We've been promised by the state, and I think I've mentioned that in several conversations, the fact that we will be receiving a deluge of vaccine heading our way in the next 4 to 6 weeks. That remains to be seen. There is no clear timetable associated with that. And in all fairness to our state partners, they don't either. So we'll keep an eye on that. In terms of vaccination rates by age group, this is where the crux of the difference is being made. This is the most vulnerable age range, as you can imagine, the 60 to 79-year brackets, as well as the 50 to 60-year-old brackets. That is steadily increasing. This is very good news because that's where the long-term care facility, the nursing home residents, the elderly, the senior citizens who otherwise don't have too many options in terms of transportation, et cetera, would be. And so that is the population most at risk for the severest sequelae of disease. We're very happy with that. As of April 9th, of course, tomorrow in Missouri, people 18 and above will become eligible. Any adult in Missouri will be able to get a vaccine. The only limiting factor there, once again, is the actual supply. If there isn't enough supply available, then of course, in order of priority, it's the older individuals, the people with chronic disease, the homebound, deaf, disabled, blind individuals, people with chronic diseases that really are at higher risk will be prioritized. And we have our own registration lists, which we go through regularly to make sure that we cater to them. And that also shows you the percentages of fully vaccinated individuals versus at least one dose. And that is good news in the highest risk category, which is 60 plus. In terms of overall vaccination updates, so variety is the name of the game. What the approach that we're taking is to try and provide as many opportunities in as many forms as possible so that people have a menu of options to choose from. And when they call us or contact us to ask about events or opportunities, we're able to walk them through different modalities, whichever one works for them, including the permanent clinics, of course, that we have at John C. Murphy Corrections Medicine in South County, as well as North Central Community Health Centers, the community college at the Florissant Valley location, the mass vax events that we've been staging with the Missouri National Guard, daily sites that are operated by our fire and EMS partners in Afton, Eureka, Melville, Pattonville, Richmond Heights, Metro North, and Riverview Gardens, county park locations, which are typically mass vaccination events only. And I'll touch upon those in a little bit. The targeted zip code event piece is very important to note because we were the first ones in Missouri to undertake that approach as soon as that clearance became available from the Centers for Disease Control and Prevention, as a result of our asking the state to request permission from the CDC to do that. That event was staged in North County and was successful in terms of the number of people served. Excuse me. And so we very much want to follow that up and partner with other agencies to do more. The pop-up events are just as important because instead of the mega mass vaccination events that we typically process about 2,000 doses at every event, you can imagine the amount of hard work, logistical planning, operational planning, et cetera, that it takes to stage one of those events. The pop-up events are somewhat easier because you're partnering with an agency embedded in the community who really knows the community. And so we are more than likely to have a maximum bang for our buck, so to speak, when we partner with churches, community organizations, and municipal leaders to do that. That's where our focus is going to be over the next 4 to 6 weeks. An average of 2,700 appointments per day are still being doled out as we work through our pre-registration list. And I'll touch upon the registration piece later in the presentation. We are still actively seeking volunteers, both for clinical and non-clinical roles. And so to everybody who's listening, for each clinical volunteer that we have, the doctor, nurse, phlebotomist, medical assistant, et cetera, we need at least 4 non-clinical volunteers to help with tasks like crowd control, registration, running things from station to station, moving things around, helping us set up and close down, etc., and making people comfortable and observe them as they wait after their vaccination, so that we don't leave anybody on their own, and we make it as easy and as comfortable as possible for everyone. Coordination with community partners to actually reach patients across different sectors is also a major push. As I mentioned earlier, as of April 9th, all Missouri residents over the age of 16 will be eligible. The state of Illinois has already done away with those restrictions, and so people 16 and above are eligible there. Our emphasis, our greatest thrust, I would say, is on continue to provide vaccine access points for those who have already registered and are at greatest risk but have not yet received a shot. These are the senior citizens, that 30% remaining part of the bar chart that I showed you, that are still at risk but have not received a shot. That is the most high-risk group still left. This map obviously tells a story. So this is self-explanatory. This is the area of greatest need, and there are pockets in South County as well. This is where our pop-up events, our mobile events, etc., and other smaller community church-based events really need to focus. This area here also tells a story. These are the comparatively affluent parts of the county, I suppose. And so the population residing here was easily able to access mass vaccination sites. These are the folks that these are the folks that drove the 250 miles west or 100 miles north at some of those rural sites, and the stories that everybody's heard. And so the coverage here is fairly good. It is better, in fact, than the rest of the county. Probably still not up to where we would like it to be, but that is a supply and availability issue. So there are no real surprises in the map that we see in front of us. And this data is current as of April 1st. It may have improved a little in the weeks since, but probably not much to alter this picture. In terms of the communications and community engagement plan, as I mentioned earlier, we are reliant on the state for vaccine supply. There is very little that we can do in terms of changing supply. All we can do is plead with the state, and they in turn plead with the feds. I wish it were better. So this document, basically, the plan serves to outline our communication strategies and provide an update to our community engagement so far. And I'll talk about that a little bit. In terms of communication, I won't read all of this. Please don't worry about it. This is for your reference. You've seen the press release related to the video PSA campaigns. That's one modality to get people out there. The goal, of course, is to reduce vaccine hesitancy by highlighting reasons to get a vaccine and to reassure people about any side effects or dispel any myths that they might have carried with them. The PSAs are embedded on North and South County stakeholder group websites, and we're pushing them out to all social media accounts as well. There is another tack that we've also adopted, which is to have printed materials available at an easily readable and understandable level of comprehension in different languages. And as an example, we worked with a community partner to have the printed materials distributed along with food boxes that were given out to the community. We also took out advertisements and publications that target some of our most vulnerable communities in North County and in South County in terms of promoting awareness. There are vaccination events being promoted and social media campaigns ongoing, and you will see a deluge of those. We have solicited external expert advice on trying to combat vaccine hesitancy and dispelling of myths. There's been a lot of research work done on it. Obviously, there's a ton of strategies being proposed. Our history with the virus only being 1 year old, the federal and state systems across the country are still learning. And so that will be a feature that will develop later in the year. As I mentioned earlier, linguistic diversity is important for printed materials. We're focused on that. This is a sample of the print material as well as the other stuff that we've put out. Basic facts in different languages, virtual town halls at which the county executive and other individuals, including medical professionals, spoke about the availability of vaccine and the importance of getting a shot and encouraging everybody else around you to get vaccinated whenever eligible. The community engagement piece is focused on raising awareness and building trust and relationships and capitalizing on those to remove vaccine hesitancy and improve awareness. We've convened meetings with community leaders from a variety of ethnic groups, and we've tried to put material out there in a variety of languages. Obviously, the migrant communities in the St. Louis region are also just as important. So the variety in languages is critical. We've tried to build trust through town hall meetings, sharing facts, and working with medical experts from Mound City, Generate Health, Show Me Hope. The BJC Health Network has been a great partner in that. The Demetrius Johnson Community Affairs Show is one venue at which our team has tried to take the lead in putting the message out about available vaccination opportunities. And of course, as I mentioned earlier, the first ever vaccine event in Missouri for targeted zip codes was on 3/25 and then 3/31, and a total of 2,600 doses to only North County zip codes were administered on those days. The North County Outreach Group primarily works closely with the DPH staff to bolster our response. They have bi-weekly meetings. They have more than 45 members and are growing every day. There is a very healthy environment in terms of bi-directional feedback and conversation. This is not didactic. This is not a dumping of information or a death by PowerPoint type approach. This is very much a conversation. There is a lot of good feedback and a lot of good conversation that takes place. It's very transparent. And the group leaders report back on the progress and recommendations from the community every single week. In terms of the stakeholder group directed activities, it's important to understand that this is not something that we tell them to do. They're the ones that direct the process. They're the ones that tell us how things should be. For example, forms of communication, community organization, newspapers, newsletters, websites, social media accounts, different language formats, enrolling individuals with multiple barriers, including reluctance, alternative ways of sharing information, scheduling by health educators, which was an innovative approach. It wasn't just pre-registering, it was scheduling the actual appointment so that people who have trouble accessing the internet or working a smartphone or a laptop have somebody available to them to work through that and set up an appointment for them. And of course, the groups have created subcommittees that meet bi-weekly to plan events such as town hall meetings and registration events, which is amazing. In terms of ongoing engagement, we have a speakers bureau. They've done 5 town halls at this point and more are planned for the future. We also hosted on March 25th a Get the Facts panel of community experts in a town hall format. That was very well received. We're conducting key informant interviews and surveys and in focus groups to try and better understand what is it that the community would like to see in terms of vaccine awareness and availability. And for industry stakeholders and youth sports advisory groups, that's another engagement. There's also Latinx and immigrant advisory group engagement, as well as engagements with Prepare STL and the regional response team. All are geared towards getting vaccine to people ultimately in whatever format is most convenient for them. This is important and we're very proud of it. The vaccine clinic for blind, deaf, and disabled individuals. So we've worked with UMSL, Deaf Inc., and Paraquad on a special clinic for deaf, blind, and disabled individuals. You don't have to be a county resident to participate. The clinic will be held here at the John C. Murphy Health Center, 6121 North Hamley Road in Berkeley on April 29th from 8:30 a.m. to 4:30 p.m. The location here is completely ADA compliant, and we aim to give out 800 doses and will provide appointments for second doses on the very same day. All these agencies, UMSL, DEFING, and Paraquad, will have reps on site volunteering with us so that everybody is received and processed as conveniently as possible. And we will have written material available for the blind community that has been carefully prepared by DEFING. All family members and caretakers that accompany folks will be vaccinated if they choose to. And if somebody doesn't, we'll add them. If they're not there physically, we will add them to our list. We will schedule appointments directly to our partners at Paraquad and DEFING, which makes it easier for our team to work through them to access these communities. We continue to receive referrals every day from agencies about senior citizens and older residents of the county, and they continue to pre-register and schedule appointments every day as well. In fact, core staff regularly correspond to emails and phone calls about vaccine delivery. It's one of the aspects of reaching out to the most vulnerable segment of our population that we're very proud of. Spring, would you like to add something about the partnership we have with CORE?
Sure. So CORE is the County Older Residents Program. It's run by our Department of Human Services. They really stepped up, and the need was overwhelming. They added additional volunteers to help man their phone lines. We partnered with the St. Louis Area Agency on Aging to capitalize and expand to make sure that we are consistently listening to what is happening with seniors, to work across the barriers for transportation, for homebound patients, for registration, for those who lack digital access or just struggle with the complexity of the system. So CORE has really just been a partner that's been heavily motivated to make sure that they were getting residents into the system. And so we've really appreciated that partnership, and DHS has been a great partner for us through this whole pandemic.
Thank you. As Spring mentioned, the residents are continuing to be scheduled. Transportation assistance is something we've partnered with Bi-State on, both for first and second doses at the North County Rec Center event. There is a call center assistance available in verifying people's appointment times and locations. CORE individuals are also calling people to assist with registration and scheduling. So it's a multifaceted, multimodal approach through different venues. We also have staffing for the DPH COVID vaccine inbox whenever people send us messages or try to contact us about scheduling issues, rescheduling needs, trying to group family member appointments together so that people don't have to make 5 or 6 separate trips, transportation being a huge barrier, and accommodating date and time requests for caregivers and family members so that they can bring their family members with them. That has been one of the most well-received aspects of the flexibility that we've displayed in trying to reach out to people. Just to give you a grid matrix look of all the partnerships, the core partnerships we have. Spring, I'm going to invite you to comment on this, and then I'll add.
So these are events, some of the things that we've done, so various members of the leadership of the department have participated in speaking opportunities, town halls, engagement opportunities, where we are taking questions and speaking to the public about the opportunities for vaccination. And so there is variety. We've done some smaller events too, but these have been some of the bigger and more well-attended community events where we were a panelist or a speaker or a featured presenter to make sure that we were getting the word out into the community. And all of these are also places where we take questions so that we can hear the voice of community members as well, either through a chat function or through panel questions or through mediated questions. And it starts with back at the beginning of February, I did a town hall for Congresswoman Cori Bush, which had a great amount of attendance, and we've just continued to push that forward really nearly every week of the pandemic, and we keep wanting to do that.
Absolutely. No, I think you covered it all. This has been an intense process, and what I would invite everybody in the audience to try to imagine is the time and effort it took to sequence some of these conversations and make sure that everybody in the teams at these partner agencies is also looped in on the communication. it took a lot of effort, and it's beginning to bear fruit. In terms of upcoming events, we have a town hall coming up with the Black Nurses Association on April 23rd. We have a faith-based event on April 24th as well. We're transitioning community outreach towards offering pop-up events, as I mentioned earlier, for particularly vulnerable populations like deaf, disabled, and unhoused. And those efforts will, excuse me, solidify within the month. I've already covered the piece about the clinic for the especially disabled individuals, deaf, disabled, and unhoused, deaf and blind on 429. We're working with the Disability Commission to improve access at the mass vax and clinical sites as well. That's been a challenge because we don't really exercise a lot of control over the sites that we have. And so when we identify a new site, we try to find one that fits that mold and allows for easier access and meets as many criteria of ADA compliance as possible. That is not always possible, depending on the site. You know, if it's a parking lot, it's a parking lot. If it's a warehouse, it may have steps, etc., that don't really work into that format. But that effort continues. The FEMA site at the Dome. So this has changed in the last 12 hours, as you well know. I'm sure you're privy to the same headlines that I am. Initially, you know, we were partnering with FEMA for the site at the Dome. It turned out that they really didn't need much help. They had their own vaccine and their own vaccinators, and they were aiming to do upwards of 3,000 vaccinations per day. They only ended up doing 713, I think, on the first day, which was a very disappointing outcome. And so the initial restriction they had was either St. Louis City residents or folks from St. Louis County from certain zip codes, which was a list that we gladly shared with them, the most vulnerable and underserved zip codes. But based on the outcome that they saw on the first day in terms of low turnout, and we did warn them, transportation is a major barrier unless they're willing to invest significant resources in that, it will be a barrier. They've relaxed the requirement in terms of who can come through. So now it's open to anybody who wishes to receive a shot, including people who've already received their first shot of Pfizer, for example, at another site. And Spring, correct me if I'm wrong, but I don't think they're administering Moderna.
So we're confirming that. We have a meeting at 6:30 tonight. And so we're confirming they were using Moderna, but we think they're switching, but we have not seen that confirmed yet.
So that's another thing that we do want to publicize to everybody. We're hearing from residents about, you know, they've driven out 200 miles or gotten their first shot out of state somewhere because that was the only avenue available to them, or that's where they were at the time. They're now desperate for a second shot, and we are restricted in terms of what we can provide them because it throws somebody else off the schedule. So this is an excellent opportunity for people to go there and receive a second shot. FEMA is not being discriminating at the moment. We are working with the National Guard targeted vaccination teams for high priority populations as well. There are 6 housing and urban development housing facilities / complexes that have been identified, and hopefully the Missouri National Guard will be hitting them within the next week in St. Louis County. Spring, any comments on that?
So I would say this is also a partnership with the Urban League. The Urban League has been working with the target vaccination teams in the city for the last several weeks. They've expanded that partnership with us. So they wanted us to help identify some additional locations in the county that they could go around and do these mobile events at. And so that was great conversations that we had with Mr. Clark and the target vaccination leadership from the National Guard. And so we've identified those HUD housing facilities because we'd been wanting to get to them for a while. So they were ready to go. And we're also partnering with the Urban League on the Delwood site.
Right. This morning there was, and thank you, that is an excellent segue. I should update that. Councilwoman Rita Hurd Days was there. Rita Hurd Days was there as well, and Congresswoman Cori Bush was there, in addition to several mayors. The Delwood Recreation Center is is a site that the Urban League has identified as a vaccination site, and they aim to provide upwards of 1,600 doses at each event. The state Department of Health and Senior Services is working with the Urban League to provide them vaccinators and vaccine for that event. We are delighted about that. We are working with James Clark and his team to make sure that we make it as easy as possible for people to sign up and go through that and help them basically with the logistics and registration, etc. That site will hopefully develop as a semi-permanent location. That is our hope for the next few months. Some other partner agencies that we've had in some detailed dialogues with the county NAACP has been a great source of help. Vitendo for Africa, which is a conglomerate of different community organizations catering to people who've moved from Africa to the St. Louis region. The Hispanic Leaders Group, the Black Chamber of Commerce, the area on I'm blanking out on the last acronym. Spring, help me out.
Community Action Agency of St. Louis
I knew it.
Castle.
Sorry, I knew it. The City of Delwood, City of Ferguson, Mount City Medical, the Urban League, Kojik, of course, is a major faith-based partner. The Vietnamese community, a nursing sorority that we were delighted contacted us and volunteered their services. We're working with them, and the Black Nurses Association. And of course, the regional response team, of which I think you are chair for our region. Is that correct, Spring?
I'm not, but I am on the sponsorship committee.
There we go. Okay. Suffice it to say that part of the outreach is also constituent services. With the pandemic, we've obviously seen an increase in constituent calls, emails, queries, complaints, questions about the virus, how to access testing, where to go to get a vaccine. If somebody had a less than ideal experience, they also are not shy about letting us know, and we welcome that feedback because it helps us improve things. Obviously, council engagement is one major component of this. The call center is operational 314-615-2660 for anybody who has any questions. We have a chat bot that is currently active, and I think that's at the county level, and a voice bot that will be active soon as well for anybody that wants to activate that, access those services. The senior resident support services is a very key component of everything that we do, and we're very happy with our partnership with CORE and Oasis. Obviously, the email address is dphcovidvaccine@stlouisco.com, business-covid, business-covid@stlouisco.com, and dph.ppe@stlouisco.com are up and running. We respond to any and all queries in as quick a manner as possible. It sometimes takes a little bit of time to gather the facts necessary to provide a meaningful response, but we are fielding lots of calls and queries. Spring, any thoughts on that?
I would just add we still do PPE and we still do plan reviews. And so that's some of the other customer service work that we do that's important to us.
Thank you. That is the end of the presentation part of this.
And thank you, Mrs. Brent, for giving us their presentation. And before we go to my colleagues now, the question, I do want to let everyone know that we welcome the public to this conversation. We're grateful that you all came before us. As I shared with both of you, this discussion wanted to know what was going on, how could we have any gaps and help get the word out to our communities. It is imperative, especially since I represent one of those communities in the upper north that's all less than 2-digit percentage of vaccinations. That we make sure that we are aware of what's going on and we are addressing the needs of the community as best possible. To me, it doesn't.
My apologies, Madam Chair. Your video feed is breaking up.
What, as long as it's getting done. And so we want to be of help here. Again, the presentation was very thorough, but I know that my colleagues and I have some questions. And so at this time, I did not introduce my colleagues in the beginning because I was having technical difficulties and you could barely hear what I was saying. But at this time, I know that we have with us Madam Chair. Go ahead.
Councilwoman Webb.
Dr. Khan, you want to say something?
Yes, well, you were about to introduce us. I'm not sure if that's where we want to go at this point, because I know you are having trouble with your connection there, and this is why we absolutely have to get back in that chamber as soon as possible. This is unacceptable, totally.
So yes, I am having challenges with my video feed. I apologize for that. Hopefully you can hear me.
In and out.
And with that, I'm going to turn it over to my colleagues, allow them to introduce themselves, and then address any questions that they may have. Let's start with Madam, the St. Louis County Chair, Ms. Councilwoman Rita Days.
Okay, thank you so much, Madam Chair. And I know it's hard when you cannot hear and we cannot get you, but first of all, thank you, Dr. Khan. We first met, I guess, a few hours ago at the Delwood Center. We had a press conference there, but Spring is aware of this, and I personally would like to have, if you have a presentation like this, I'd really like to have that presentation before so that I can formulate questions. I can look deeply into the information that you're giving us. It's difficult to see all of that on this tiny little screen here, but I know that Chris will probably yes, Councilwoman Webb, I'm in the middle of a question right now. Is that okay? Oh boy, this is tough. Okay, so I'm going to continue on. So I had asked, and for each presentation, I've continued to ask for this information before. You throw this information at us, but it's hard to look at the information and glean what you're giving us and then ask questions as well. So that would be something that I've asked for on time and time again. Spring is aware of that. And of course, Dr. Khan, you're just getting here. You have not. I'm looking at the map that you gave, and I hope I saw that correctly. You still have a major absence of the vaccinations in the North area. You have put all these plans together, I'm assuming. The first question I had asked, and I'm not sure if I did see this, was the plan of how you are going to implement the outreach. I saw some things there. I'm not sure, did I see any public service announcements? I know that you mentioned, I think one time, I think you said something about Demetrius Johnson, but those are talk shows. But do we have anything that we're just kind of doing a public service announcement? This is where you can go. This is what we need. Do you have anything like that?
Yes, ma'am, we do. And if I could just begin, I sent a copy of the presentation over to Chris and Shante Young, I think, at 8 a.m. This morning. As far as the outreach plan, yes, ma'am, the PSAs are being shared as widely as we can, and we've requested all our community partners to embed those on their websites and share those on their social media platforms. Spring, would you like to add to that?
Yes, so we've done traditional advertisements through a wide variety of media, and we've also done print materials that we've placed out in various locations, that we've shared with municipal leaders and partners, that we've been sharing with churches, that we've been printing and handing out both digitally and in paper copies as well. So we've been putting information out in both traditional and non-traditional ways. We've been coming to events and speaking and scheduling, and we've been advertising in a wide variety of media.
Okay, and Dr. Khan, I did not get that presentation. So if you sent that, then I apologize for that, but I did not get that at all. So when you, and again, you know, the focus, it seems to be on social media. The focus is on digital. We need to get phone numbers out to people. And I had suggested door knockers, and we had also talked about the pamphlets. I think you put those together. I thought I saw briefly one that screened across here. I'm not sure if that's what I saw, but that was it. And the other thing too is that you recognize that when, particularly in North County, engaging your local elected officials is an excellent way to get folks the information. You know, I have 40 mayors in this one council district, and they are aware of the pockets that need this kind of support. But according to the mayors that I've talked to, they have not been engaged in this process at all. And they show up at the press conferences like they did today, but actually in coming out and saying, you know, this is what we need from your community, that has not happened. So I would urge you to reach out to them individually, and particularly in looking at your public housing residents. I thought I heard you say that something is happening along those lines. So that's good, but we have these mayors there for particular reasons. That's what they do. They've been elected to their, you know, in their areas, and so they know the people. So I'll stop right there for a second and let someone else ask questions if they have any. Thank you. Madam Chair, thank you.
Thank you, Councilwoman Rita Days. Can you all hear me? In and out.
In and out.
Would you? Okay. Councilwoman Rita Days, would you please direct the traffic? Because I don't want to hinder this meeting. And ask our other council members.
Okay. Any other council members with any questions or comments or suggestions that you might have for this? And so probably all of you got the slide presentation beforehand.
No, I got it at 4:42 p.m. So I am a little concerned that there was a delay in when it was sent and when it was shared to us by our staff.
Okay. Anyone else?
I do have a question.
Councilman Fitch?
Thank you, Madam Chairs. One of the questions I have, Dr. Khan, and by the way, we know each other for a long time. Welcome back. One of the questions I have for you as far as outreach goes. Just yesterday, the CBS Evening News reported that 41% of people who identify themselves as conservative or Republican will not get the shot. Their vaccine hesitancy that I heard you talk about. How is that group in St. Louis County, and there's still some, how is that group being addressed?
Sir, that's a very good question. And there is no easy answer to that. It seems as though at the state as well as at the federal level over the last 8-month period, you know, the rollout of the vaccine was awesome. The fact that we had a vaccine, but the communication piece was not something that was a forethought. It almost was an afterthought. And so they're now chasing the tail of this particular tiger, so to speak, and trying to figure out how to reach out to different groups that have different belief systems or may have different sets of hesitations or apprehensions about the vaccine. And so I wish I could give you a clear answer. I will have to try and research a little bit on that, and I will get back to you in writing on that. But yes, okay, you're absolutely right. That is a group that is very hard to reach, and their change in perception and belief system about the vaccine is something that is going to be very difficult to move the needle on.
Okay, and a follow-up on that, I was out at the Queenie Park event last week. Just wanted to go out there and check it out. I've already had my first shot through my employer, so I wasn't there for a vaccination, but I just wanted to see how the process was working. Wanted to be able to talk to some of my constituents that were coming out afterwards, and I did have an opportunity to do that. Now, I wasn't allowed to go inside. They said, no, you can't come in unless you're a volunteer or you're an employee or you're getting the shot. So is there some way we can arrange that? And I did not call in advance to be able to go into, especially these sites that are in our council districts.
Right.
By the way, I found out, just like the public did, that they were going to have a mass vaccination site in my council district. Is there some way we could arrange that in advance to be able to go inside? And the second part of that question is can we as council members volunteer in non-clinical roles? Because we were not allowed to volunteer in, for example, the warehouse in Valley Park that was being used to distribute PPE. So I just wonder what your policy is on that.
We don't have a policy on that, sir, other than my instructions to my team have been, and this is based on experience as of 5 weeks ago, so please forgive me. There was an instance where I think some over-enthusiastic political campaigners had tried to get into a particular site and set up tables, etc., to distribute political flyers. And they were right in the middle of the traffic of people coming in. And so we sort of asked them to leave. And then we told our team, okay, let's make sure that unless you're a volunteer or a patient or a vaccinator, you don't allow people coming in. So that is probably what was going on. The second piece, yes, we would welcome any opportunity that council members would have to volunteer in non-clinical roles. We will be more than happy to try and facilitate that at your convenience. I would have no objections to providing a guided tour off any vaccination site that we are running, and for you to take a look, and we will arrange that with your team.
Okay, and all of the constituents I spoke with that were coming out after being vaccinated were all complimentary of the process. So just wanted to pass that along to you.
Thank you, sir. We really appreciate it.
And that's all I have questions-wise right now. Thank you.
Councilman Harder, I think you had a question?
Yes, thank you, Madam Chair. A couple things for Dr. Khan and for Ms. Schmidt, if whatever applies. A couple of things. You've got great outreach. You've got a lot of people signed up in North County to help in this, getting the word out, getting the vaccine out. There's not much in West County from that standpoint of outreach groups. I've organized a few things with the Eureka Fire District. I got my shot at the Eureka Fire District. But you got all these great groups, but the message is not getting to the right people. And I'm concerned what your feedback is and what you're getting for why the African American community doesn't believe in this vaccine. And what are they telling you? Is it just access, or they just don't want the vaccine? And no matter what you do, go door to door, pick them up on a bus, whatever needs to be done, they're not going to do it. Are you hearing that? Just like what Councilman Fitch was talking in conservative circles, you've got the same situation. It's not believing in the government giving out vaccines. So what is it that you're hearing from different groups and from Asian and Hispanic groups as well?
Thank you, sir. No, that's a good question. The hesitancy piece in different communities across the United States and in St. Louis, we're no different to any other metro area in the sense that no community seems to be a monolith when it comes to the reasons for vaccine hesitancy or not wanting to get it or being afraid to get it. It varies, as Councilman Fitch was pointing out, from political beliefs to just basic fear of getting the shot based on the history of public health and clinical medicine and government's interaction with specific communities. And so we've heard a variety of reasons. We're focused on trying to get some of that data and information organized. We hear a lot of feedback through our stakeholder groups, and we're trying to do focused, structured interviews with groups of people as well to try and find out what's going on. But it largely, by and large, centers around an access, transportation barrier, but also fear of the vaccine and distrust and mistrust of the government, which is somewhat justified given the history of the African American community in terms of its interaction with government and science and public health in the past. And the words Tuskegee have repeatedly, the word Tuskegee has repeatedly come up in conversations, understandably so. So it's kind of all over the place. There really is no one set criteria or reason that would define any segment of the population as such. And documenting it and trying to make sense of it will take a little bit of time.
So how long do you keep this up? When do you say uncle when it comes to when people say, I do not want a vaccination? When does that happen? At what point of saturation? What point of, is it 50% of the population? Is it 25? You say we're at 25 or 20% now. So where do we push that and then say enough?
This is something, sir, that will continue. The effort has to continue because the people that were easily motivated were ready to embrace the vaccine, such as yourself and me and most of the people on this call will have gotten the vaccine or will have signed up or are actively seeking to get the vaccine. Those that are apprehensive but are persuadable are in the middle category. That's the group that we're working on. And then there's probably a third of people that have an absolute aversion to any information, any attempt to being convinced otherwise. That's going to be a very hardcore group to try to break into, so to speak, regardless of how many attempts we make. But in terms of the personal interactions or the targeted interactions, we tend to focus not on switching people and sort of counting them off as, we've made 3 attempts and we're moving on, but rather to try and get the message out about the basic facts about the vaccine and just show them that people around them are walking around perfectly healthy, having gotten both doses of such and such vaccine. There really is no harm. That peer type approach, that peer pressure approach is likely to make more of a difference than the government approach, trying to talk down to people, which is often how it is perceived.
Thank you for now.
Well, Dr. Khan, let me
yes.
just, go ahead, Councilwoman Clancy.
Dr. Khan, this is Shalonda Webb. Oh.
Sorry.
Do I have the floor or I'm sorry, is Chairwoman Webb talking?
Yes, I'm sorry, I have to switch devices. Councilwoman Clancy, please go forward.
Okay, got it. This is more of a comment, I guess, but I think we do need to be careful about making assumptions about any one population not wanting the vaccine. As I've talked to public health folks from around the county, including in our own health department, and I've talked to my neighbors of varying races and backgrounds, I'm not hearing hesitancy in the way that Councilman Harder framed it, as much as I'm hearing that people just need the information to be able to provide informed consent to receive the vaccine, which is why I think it is so important that you all are doing the work you're doing to get the right messages and information out to the community about this. So just wanted to offer that. I guess just one question I did have that I wanted to make sure I heard correctly. In terms of targeting zip codes, which is something that you all have done in some of your mass vaccination sites, you did say that you had to get permission from the state to do that, correct?
Yes, Councilman, because the CDC had prohibited states from doing targeted vaccination, largely because of a vaccine supply issue at the beginning.
Okay.
And so when the state of California applied to the feds and got a waiver, that sort of opened the floodgates, and we jumped in and asked Missouri to reach out to the CDC and get that exemption for us.
Got it. That's helpful to know, because I know that you tried to perhaps target zip codes in other ways by putting up, the first mass vaccination site in the county, for example, was at Flow Valley, but you couldn't turn others away from other zip codes.
Right.
In the same way you could through targeting, through saying we're only giving vaccines for folks in these zip codes. And then also as a follow-up, I heard Spring, you say that you're going to talk with the folks tonight from FEMA, I guess, about the vaccines that they're using at the Dome. And I know I corresponded with you today via email about this, but I would appreciate you all following up on what you hear about that, because from what I understand, there are age implications for that. So Pfizer is the only vaccine that is approved for 16-year-olds, for example. And I know folks who are ready to get their 16-year-old vaccinated and have said, can I do that at the Dome? And you know, until we know that they're also going to have J&J or that, until we know that they're going to offer Pfizer, we shouldn't send them that way. So I would appreciate hearing that follow up from you once you get some clarification on that.
I do not expect them to offer Pfizer. My understanding is that they do not have the cold chain capacity in the Dome to offer Pfizer anyway.
Okay, got it. Well, yeah, but I guess also too, that's a distinction that, so yes, even though we're going to see more and more 16-year-olds and younger folks getting vaccinated, that is only, they're eligible, but they can only still receive Pfizer, correct? Yep, okay. That's all I got for now. Thank you.
Thank you, Councilwoman Clancy. Councilwoman Days, thank you so much for filling in. I hope you all can hear me better now. I did have to switch devices, and I hope this is much better. My
That's much better.
council PC is not cooperating. I did want to pull on that thread that Councilman Harder brought forth, and Councilwoman Clancy elaborated on some. Before we start to think that it's a hesitation just from historical interactions with medical and government, I want to make sure that we actually try all other options prior to thinking that it's just a hesitancy because of historical background. And when I say all other options, Dr. Khan, we've had a personal conversation, and that's same-day registration and vaccination. And so, as I told you, I know other states are doing it. They're doing it quite well. And I'm not understanding the hesitation in Missouri, other than having the dosage. Now that we know that even at the Dome, they have more dosage than those who want to participate, we have to come up with a strategy to move those dosages around to the North County area. I don't believe we're going to get the impact in North County until we can do registration and vaccination at the same time. I commend the Mayor Jones in Delwood for creating that satellite station in his area. I would love to have Redmond a satellite station for this part of North County ongoing, but until something like that happens, I will be continually to push that we just need same-day registration and vaccination. Now that the restriction on April 9th is going to go away, talking about as it pertains to the different tiers of priority, we need to make sure that we can actually service this community. I also want to pull on a thread, and these are all comments, I know, but I want to make sure that they're heard. As Councilwoman Ritter Day said, all of the emails, all of the virtual meetings, none of those things reach the community members that don't have access. So we can send flyers all day long. We can also have 101 virtual meetings, but if they don't have access to it, it doesn't help them. Even the flyers that we're putting in the food pantry boxes, yes, that is helpful, but until I'm so on board with Councilmember Ritter Days, until we can go door to door to make sure that each household is covered, we will not see that impact of service to North County. And I feel like that's going to be a detriment to our community.
If I could just respond, Spring, actually, do you want to do the honors on the registration piece?
Sure. So we are, especially after this opens up tomorrow, so we are going to be dropping our registration piece. We did want to make sure that those people who have heard from us or who have signed up with us did get multiple emails from us and opportunities to schedule themselves, because some of them have been on a list for a long time. And that is a very big list. There were over 480,000 registrations on that list at one point, and we did not want to just leave people hanging. And so we will be moving to open scheduling, and then we will be moving and piloting walk-in registrations. We did tell you that it was coming, and we are moving in that direction. So we do know that is where we need to go. It has been focused on dropping barriers, but it has also been on some of the people that have been on our waiting list for a very long time, as well as how we're moving through some of these pieces. So everyone on our registration list has been emailed by us at least once, and most of them have been emailed up to 4 times for an opportunity to schedule at one of our events so far. And now we're excited to be moving forward with that registration, and then open registration as well. Open scheduling.
I think you're muted, Councilman.
You're on mute.
I hope my video is working and you can see the smile on my face because I've been
Thank you, ma'am.
screaming
Thank
for
you.
a long time about same-day registration, no registration and vaccination. So thank you. So the next step is to make sure everybody knows that, to ensure that the community in North County knows that you don't have to register, that you can go to these sites. And so I would love to hear that execution plan on how we're going to start that. PSAs on internet is great, but again, if you don't have internet, you don't hear it. So radio and TV is going to be another option for us. So again, I am happy to hear that good news. So thank you, Dr. Khan. Thank you, Mrs. Smith.
Thank you, ma'am. If I could make just one request of all the council members and their aides here. Yes, we will need to publicize that, of course, and we will make sure that we send you all the materials in terms of getting the word out about the fact that people can walk in, register on site, and receive a vaccine. That's going to be very important. But also, in terms of managing expectations, it's important. We've run very efficient sites, as Councilman Fitch has experienced firsthand in terms of the feedback from constituents. You know, we try to get people in and out as quickly as possible. Obviously, if there's on-site registration, it adds about 10 to 15 minutes for somebody to get there and then sit down with someone, a volunteer or a staff member at a computer and have their information entered, and then they go and get their shot in line. So that expectation has to be built into the message to say, yes, come on site, but make sure you budget enough time to get registered on site and then go through the process. And that's just a request.
We definitely can help with that messaging. Yes, sir. And myself had experienced a great, when I went to the Redmond mass vaccination, it was run very well and the accommodations were great. It didn't take long at all. I'll be back there on this Saturday, not only receiving my doses, but also volunteering. So again, we will help with that messages. We just want to make sure we have the message and the resources to get it done. I did jump in midway and other council members were asking questions. Are there any other of my colleagues that have questions at this time?
Madam Chair, sorry. I think Councilman Harder was before me.
Councilman Harder, yes.
Thank you, Madam Chair. A couple of the questions. What's going to happen when we reach a point where the demand for the vaccine is lower than the supply? We're seeing a lot of supply coming in now, and that was always the flip-flop, was always the big thing, and we blamed everything on supply. Now supply is up, but the demand is not. So at what point do we say we're not going to vaccinate anybody, or is this going to be forever? When do we come up with that issue and that balance?
At the moment, sir, that is an impossible question to answer because of the way the disease is ongoing. We're still in the middle of the pandemic. We're focused on making vaccine available, and it will be available, I suspect, even with increased supply for quite some time yet. We may get to a place in time some years into the future that getting a booster shot of the vaccine may become a routine part of our lives, just as people get a flu shot every year. But as far as timeline, it is impossible to predict.
Okay, and secondly, is you talked about getting numbers by zip code, and you meaning the Department of Public Health can track it based on what you've given out by zip code, but I've been told that there's no clearinghouse for data when you have Mercy and BJC and all these other providers and vaccinators are not talking to each other, and they're covering the same ground, whether it's North County, South County, West County. Where is the number clearinghouse going to be so we actually get an accurate number of how many people have been covered in 63011 zip code? So we know if we won or not.
Sir, that is the Show Me Vax system. We all are required to report to the state. The data that we showed you by zip code today is out of that state system. We can request data. We did receive some for the first time. So that is all county residents from all vaccinators.
So when was that initiated? Because I was talking to people earlier this week and they said it wasn't up and running.
So Show Me Vax has been initiated since the beginning. They have not been sharing data back out to us. And so
And-
we had been requesting data. We did receive some. We combined it with our data. And that is the report as soon as we completed it that Dr. Khan forwarded to all of you the other day.
How often are you going to get those reports?
We have to request it every time.
One of the issues, sir, which Spring is pointing to is the fact that Show Me Vax is a state-controlled database. We can request a report which they generate for us if they're in a generous mood and have time. But the overall picture, even setting COVID apart, if you were to ask me in any given year, let's say COVID was not even around, and you said, well, how many people in St. Louis County have had the flu shot this year? I wouldn't be able to give you an accurate picture. I would have to request the state to generate a report out of Show Me Vax, and whether or not they have up-to-date data or whatever the lag might be between people entering data and them receiving it and processing it and analyzing it, it would really depend on them. It's not an ideal system by any means. We've registered our protest with the state a number of times. Ideally, we should be able to have that information at our fingertips in a perfect system. But that is what we're working with at the moment.
What is the requirement by the vaccinators to report? Is it every day, every 10 hours, every 2 weeks? What's the lag there in data?
Generally, sir, when they open up Show Me Vax, it's a web-based entry system. And so they're entering data in real time. It's just that the transmission of the data, the collation, the verification of the data, and then it getting added to the central database to count against our totals or in our totals is something that takes time, and it can range anywhere from a few hours to a few days. One of the issues that we've seen throughout the course of the epidemic is the pandemic is that we were a few thousand doses short showing up in our data that Show Me Vax was spitting back out at us, and the state acknowledged that there was a lag in them basically processing it and analyzing it and showing it. So it's unpredictable, regrettably. It's not a perfect system by any means.
And lastly, does that system show registration by zip code and then also register and vaccines by zip code administered? Or is it just vaccines administered?
I believe it only shows vaccinations which are confirmed. The registration piece is a separate system. Spring, you can speak to that because you were.
Yeah, unfortunately, there are multiple registration systems. The county built its system in the beginning because there was no statewide system. And then the state introduced one 5 weeks later. And so there are multiple registration systems. That is an unfortunate piece of where we are, but it was because there was no system that we could all use collectively. So they have a registration system. It is separate from Show Me Vax. Show Me Vax is vaccinations only. And the registration system doesn't publicize a lot of data at this point from the state on what they have and where people are registering from. But we do tend to update people on our registrations. But we will be rolling our registration system down in the next week.
Thank you.
Madam Chair,
Councilwoman Ritter Days.
I know we have short on time, but I just have a couple of things I want to say. I think I heard Schmidt say, all these people have been emailed. Again, you're depending on a system that is not appropriate for everybody. Everybody doesn't have email, but I guess the ones that you're talking about are the ones that they've already communicated that. I just want to make sure that I'm clear about that, because don't send folks in my neighborhood email. They don't have that capability. I would like to get a copy of all the pamphlets, whatever it is that you're sending out or you have created. I would like to get a copy of those. I also need to know if you have any kind of a calendar of events that are coming up. For instance, if you have the Dome, do you have a calendar of the hours for the Dome? That would be helpful for me, so that if people ask me, I can say, they're doing this on this day. So if you could do that, let's just maybe a week or two. I know these things are popping up all the time, but it would be helpful if you could get some kind of a calendar of events. The third thing is that I initially tried to get an appointment through your system. No one answered the phone. I have had to send folks that in my area to the Southside Wellness Center so that they could get theirs. I tried several times to get through on the phone because I wanted to register like everybody else did. I did not want to skip to the front of the line. I think I said this morning to you, Dr. Khan. And so, but I will tell you that this Delwood, I was on the phone. I left a message, and before I could completely finish the message, someone was returning my call. I was able to get registered within 3 minutes. It could not have been any more. So there is a way to do this. There are people that are doing this. And so I just want to make sure that you understand this is a partnership. We're trying to, everybody doesn't know everything about everything. And so if you kind of lean on us for, some kind of input, we'd be happy to do that. But we are not adversaries in this. We are trying to coalesce so that we can get our folks taken care of as they should be. We have 7 members, and they all have constituents. They all want this. If they don't, that's fine. But I don't want you to think that our hesitancy in our community is based on whatever. It is not. We don't have the opportunity. We don't have the information. We don't have the outreach in our area to get this done. So I just want to leave that on the table. We have to do better in terms of the outreach. Thank you, Madam Chair.
I hear you, ma'am.
Madam Chair.
Councilman Rita Days, Councilman Fick.
Thank you, ma'am. Dr. Khan, in your slide number 3, you show 28% statewide initiated vaccination, right? 17% have completed it. What is it for St. Louis County? How many have initiated vaccination for St. Louis County?
I can probably, the best figure I can cite for you, sir, and this does have a lag, roughly 25% of the population in the St. Louis region has been, the St. Louis County area has been vaccinated.
The initial or both?
Spring, was it for both shots, or was it for initiation of single shot?
Give me 1 second. I'm pulling it up now.
Yeah. Sorry, you just caught us off guard there for a second.
Yeah, that's the only part of the PowerPoint I didn't see where it specifically addressed St. Louis County, which is obviously what we're interested in mostly. While she's looking that up, Dr. Khan, first of all, let me say it's nice to be able to talk to you directly. Because we never had the opportunity to talk to Dr. Duchette, who was signing all the public health orders ever. Spring was always here and available for questions, but Dr. Duchette wasn't. So will you be the person signing all the future health orders related to vaccines or anything else?
All medical orders will be signed by our chief medical officer, sir. That's the process that we've set in place. But in terms of the public health orders, that will be under my signature.
Okay, thank you. Spring, interrupt whenever you're ready, and I have one more for Dr. Khan.
28.6% of those that are currently eligible are vaccinated.
So that's actually
The first dose at least.
Pretty much in line with the statewide average. Okay.
We are, yes.
So using these vaccine numbers, and I know I've heard Dr. Garza say this several times, that there's several different ways that they decide, what to recommend as far as shutdowns of restaurants and those type of things. So vaccine-wise, since we're talking about vaccines, what's the number we need to get to? What percentage? Right now we're sitting at 28.6%. What percentage do we need to get to, and how does that play into allowing restaurants and churches to reopen at 75% or 100%? What number would that be, since you're going to be the one issuing those?
It is impossible to pin that sort of decision on just one metric, or just the vaccination numbers alone. Because if we did, quite frankly, from a process perspective, we are at 28%. We will struggle to get up to 50% maybe by the end of the year, for example, given the pace at which people are picking up the vaccine. That is my cautious optimism at work here. I would love it if we got up to 75%. I mean, that would give me a lot of assurance. There are other points of information and data points that would feed into any such consideration, but that's kind of the lofty goal here. Realistically, this metric alone, the vaccine percentage alone, is probably not a good one to use there. We want everybody to get vaccinated, but what does that mean? We really don't know, because it hasn't happened anywhere in the country for frankly, even the world to give us some idea of how that plays out.
And you cut out a little bit. Did you say we would struggle to get to 50% in St. Louis County by the end of the year vaccinated?
I am always a skeptic. So my team is probably more optimistic than I am. We're at 28%, and this is sort of the part where, the people that are easily motivated or are willing to listen are likely to make the decision to get the shot. And so when we get to, well, let me put it this way: when the FDA authorizes shots for kids, hopefully later this year, whichever vaccine becomes available, that'll cover a significantly more segment of the population. So we'll creep up. There will be a 10% jump, a 12% jump, etc. When we get to the end of the year, I definitely see us being over 50%, but not by much. That is my realistic and deliberately skeptical assessment.
So is it possible that our restaurants and churches could still be closed down the entire rest of this year? If we get to a certain, what if we got to 100%? Would they ever be open? I mean, you tell me.
I would hope that would happen a lot sooner. Absolutely. And the reason I say that is the important thing to keep in mind is the next 4 to 6 week period, which is critical. If we don't have a deterioration, if cases remain relatively stable and continue to plateau out or decrease, right now we're seeing a slight uptick. 1 week's rolling average is up, the next week's down. So it's a bit of a roller coaster. Combine that with the fact that 70% of new cases being diagnosed across the US are attributable to the UK variant, which causes more aggressive disease in younger individuals even. So all those things, if that does not play out in the worst case scenario over the next 4 to 6 weeks, I am very optimistic personally that we will be in a place where we can possibly look at further relaxations in public health orders. I absolutely want to get there. Our team wants to get there. But that's the period we're looking at. We're certainly not pegging this on the percentage of people that get vaccinated. The more people that get vaccinated, the better. Of course, if it's 100% by the end of December, I'll be doing cartwheels around the block. But
what percentage of St. Louis County's population do you identify as children? Is that the 16 and under?
I would say 16 and under at the let me put it this way. Various scientific conventions identify children as 13 and under, but for the vaccine purposes, for COVID vaccine, because the manufacturers did not recommend it for 16 and below, that's kind of the age range that we're looking at. So 16 and below is children, so to speak.
And what percentage of St. Louis County's population is 16 and below? I'm trying to figure out, if you take 100% of the population and if we're just looking at adults getting vaccinated, what would those percentage breakdowns be? Do you know?
Not on the top of my head, sir. I would have to go back and look at the census tract information. That would be the most reliable source, really. And I would be careful in drawing inferences, because even the state of Missouri, as you know, goofed up with their racial data when they looked at the Fed database instead of looking at Missouri's census on determining the race-based breakdown for vaccinations, and they had to backtrack. But I can look that up and email that to you.
And one last question: some states, I believe it was California, said we're reopening 100% June 15th. How do we not have some sort of goal like they have in some states like that? I hate to use California as an example, but because they've had such an issue out there. But how is it that they can tell the businesses in advance and churches, be ready by June 15th, and we can't?
I would venture to say, sir, it was a very bold and reckless thing to do, because, and I say this facetiously, I'm not smiling because of the situation down there. California's had wave after wave of variants come through, and so they've had multiple shutdowns. I think it was less than prudent to set that timeline and give people a false sense of hope, because they might blunder into June and be in the middle of this thing. The Southern California variant of the virus is wreaking havoc in California even now. So they will have rolling lockdowns and shutdowns and restrictions. They're not in a good situation. And I'm actually relieved that the state of Missouri didn't do that.
Thank you, Doctor.
Thank you, sir.
Councilman Fitch. Thank you, Dr. Khan. At this time, it's 4 minutes until the top of the hour. I don't know if we have any additional public comments, Ms. Diane, that may have come in.
No, Madam Chair, there are no public comments.
Thank you. I want to thank all of our panelists, Dr. Khan, Mrs. Smith, for coming today and giving us a thorough, open, transparent conversation about the state of our outreach for COVID vaccination. I'm also very thankful to all of my colleagues for having thorough questions to ask, sincere in their questioning to come to a resolve, not as my colleague, Ms. Councilwoman Rita Day said, not that we're adversaries. We want to work together to get a solution for everybody. And so I appreciate the tactfulness that was used today, and I appreciate everybody working together to inform our community and then work on behalf of our community. So again, thank you, Dr. Khan. Thank you, Mrs. Smith. Thank you to my colleagues. We look forward to getting any additional feedback. One ask that I have of you, when you have those non-registration events, mass events planned, please communicate that with us as early as possible so that we can get that out to our community. Again, I thank everyone. If there are no other questions, I would like to adjourn this meeting. Do I have a motion to adjourn?
So moved.
Second,
May I have a second? Thank you
Second.
all and have a great day.
Aye.
thank you.
I'm sorry, vote
All right.
all in
It's all good.
favor.
Nobody's gonna say.
Aye.
Thank you. All right. Thank you all.
Bye-bye.
All right.
Okay.